Hello everyone, my name is Kinichi Hotta. I'm a Deputy Chief of Division of Endoscopy, Shizuoka Cancer Center, Japan. Shizuoka is one of a prefecture in Japan located near Tokyo. We can see a beautiful landscape from our institution. This is Mount Fuji, the tallest and most beautiful volcano in Japan. Mount Fuji is commonly used as a cultural icon of Japan, and of course, we can climb it in the summer season. Next photo is Genbei River with my dog. This river was supplied with water from spring water of Mount Fuji. Our institution is also surrounded by the beautiful rose garden. Please come visit to Japan and our institution. First, I would like to introduce the first author, Dr. Takada, to this author interview.
Hi, I'm Kazunori Takada from Shizuoka Cancer Center. We are honored to have the opportunity to present our recent accepted paper in GIE, titled Tip-in Endoscopic Mucosal Resection as an Alternative to Endoscopic Submucosal Dissection for 20 to 30 mm nonpedunculated colorectal neoplasms.
Thank you for your introduction. I have several questions about this study. First of all, can you introduce the procedure of tip-in endoscopic mucosal resection, which we call tip-in EMR?
A tip-in EMR is a simple modified EMR, making a spot-shaped mucosal incision using a snare tip, which we reported in video GIE on 2016. So I would like to present the procedure of tip-in EMR using a short video. This is a 25 mm flat lesion located in ascending column. So after sufficient injection, we put out a snare tip about 2 mm and insulate the snare tip at the proximal site of the lesion using cut current. By anchoring the snare tip into the submucosal layer, we can fix the snare without slipping away from the lesion during the procedure. So the fixation of the snare tip enabled us to set the snare flexibly and repeatedly in the appropriate position. In addition, by use of a gentle push of the snare became wider laterally and allowed itself to be positioned appropriately around the lesion. And after successful capture of the lesion, the snare was slightly released with distension of the colonic wall by immediate CO2 insufflation to avoid capturing the muscle layer. And after recapturing the lesion, cut current is used for resection. Successful en bloc resection was achieved with no complication.
Thank you for such great video. Why did you feel a need to do the study?
So as the rate of incomplete resection of conventional EMR for lesions over 20 mm is unacceptably high, ESD is commonly applied to such lesions in Japan. Although ESD provides higher en bloc resection and lower local recurrence, ESD is technically demanding, takes longer procedure time, and is associated with a higher risk of adverse events, thus making it less popular in the world. Our previous randomized controlled trial showed that compared with conventional EMR, tip-in EMR achieved a higher en bloc resection rate of colorectal neoplasms measuring 15 to 25 mm. The en bloc resection rate of tip-in EMR was 90%, substantially high in this study. Recently, we applied tip-in EMR for most lesions around 20 mm and rarely experienced local recurrence. If the local recurrence rate of tip-in EMR is comparable to ESD, tip-in EMR might be an alternative to ESD. Thus, we compared clinical outcomes between tip-in EMR and ESD for large colorectal neoplasms. As ESD was more likely to be applied to larger lesions and lesions suspicious of submucosal invasion, we applied propensity score matching to control and reduce imbalance and effects of selection bias.
What does your study add to existing knowledge?
This study found that tip-in EMR is comparable to ESD for 20 to 30 mm nonpedunculated colorectal polyps with respect to the local recurrence rate, but has a shorter procedure time despite the lower en bloc and other reduction rates. We also calculated the cumulative local recurrence rate and performed a stratified analysis to confirm the findings. Based on these data, we consider that TIPIN EMR could be an alternative to ESD for nonpedunculated colorectal polyps 20 to 30 millimeter in size.
What should come next?
So as this study is a single-center study and the procedures were performed by only experienced endoscopists, the generalizability of the current study outcomes may be limited. And therefore, future multi-center prospective research, including from non-expert endoscopists, is warranted to confirm our results.
In contrast to conventional EMR, TIPIN EMR only requires a mucosal incision with the snare tip with no additional device, so you can try it now easily. We hope that our study will be helpful for your clinical practice. Thank you for your attention.